Hello, today we're going to talk about prescription drug plans offered through Medicare. Medicare is basically a system of health insurance that comes after an individual, in most cases, turns 65. You're eligible at that point for Medicare supplements or GAP plans, Medicare Advantage plans, and a lot of times you have to worry about the medications, so a prescription drug plan or a Part D plan.
The Part D plan is made up of four primary components. You've got, of course, got your monthly premium. You have your formulary list, which is probably the most important component. You have your Medicare deductible, and you also have your copays for when you go to the pharmacy window. Most of the plans, last year I believe we had 38 plans in 2020, and so we anticipate a similar number starting for 2021. And what our office does is we do the snapshot of your current medications that are being utilized, and then also we consider the ones that are anticipated. Maybe your doctor thinks you might be going into a different phase in your medical program, and so we try to anticipate those too, with the doctor's help, of course. And then we come up with a formulary that, with our computer program, it puts all the pieces together and comes up with the potential out-of-pocket expense that is anticipated for you during the course of the following year. The open enrollment begins on October 15th. We typically get our Medicare information base and figures, including the formulary listing and all the other components, early October, late September. And so October 15th to December 7th is the annual open enrollment period. That's a 46-day cycle, which is, we're quite busy during that time frame. And anyhow, what we try and do, we try and anticipate and match you with the most competitive package of expenses to minimize your out-of-pocket during the course of the following year.
For those that don't elect a Part D plan when they first become eligible at age 65, there are some potential penalties associated with that. So it's something you want to take into account. There's also alternative places to get our medications depending on what your background might be. For instance, those who have veterans benefits or potentially benefits provided through a former employer, those all want to be taken into account as we make that decision to go forward into the Medicare environment or without the Medicare environment. Either way, Shelton Insurance will be able to help you out work through that process.
You definitely want to shop your medications annually. A lot of people say, well, it worked fine for me this year, and we certainly appreciate that. We love to hear that. But in the event that, next year is a brand new ball game, so one year we might see where one of the prescription drug providers might be the best potential combination for you, but the following year they might be the worst potential combination. So with the annual shopping experience, we actually take all those considerations in hand, and we put out a report that you're able to live with and anticipate your expenses during the next year. It's an annual shopping event. We would highly recommend shopping every year, just for your own peace of mind.
And as we've evolved also under the health insurance environments, mail order becomes a bigger priority, bigger topic. Also working with your doctor to say, for instance, like, I'm on this medication for a short term. When can I come off it? What lifestyle changes or other things can I do to get off of these medications or to move into different directions? Unfortunately, a lot of cases there isn't a lot of things we can do, so we have to find what best matches your list of medications. So thank you for watching our Medicare prescription drug plan today. We look forward to hearing your comments and questions, and also anytime you have any of these questions regarding health insurance, we're more than ready to jump in and assist.